Healthcare is a human need and right. Healthcare is a human need and right.
People, not profit. Healthcare for people, not profit.
By the healthcare system, by for-profit private insurance companies. Every year, 45,000 people die because they cannot get the healthcare they need because they are uninsured. This is a visual representation of some of the suffering that goes on in this country. As President Obama is holding his summit on healthcare today, we are calling for the most popular plan from people, from medical professionals, a Medicare for all system, a single-payer national health care plan that guarantees health care for people from birth to death without financial barriers to care.
The American people choose them. Don't make us choose from a provider list that limits our care. If we had improved Medicare for all, we would have complete choice of physician, of hospital, and that is what the American people want. They want choice of provider, not choice of insurance company.
Yay!
Everybody in, nobody out.
Let me hear it.
Everybody in, nobody out. Everybody in, nobody out.
Everybody in, nobody out.
The second point the president wanted us all to be able to answer is whether or not we could end insurance company abuses with whatever reform was out there. And we believe that the plans that Congress has put forward so far, and even the president's plan, unfortunately, don't do that. There's nothing in those plans that stops the terrible denials of care that happen to patients, and nurses know that and see that every day. The nurses at National Nurses United, 150,000 strong, including the California nurses, the Massachusetts Nurses Association, United American Nurses, all support single-payer Medicare for all. And last year, when we were lucky enough to take a bus tour around this country talking about improved health care reform issues, one of the candidates we were lucky enough to support in Virginia was a wonderfully strong woman who advocates for single-payer, and she did so as a candidate. We hope we'll get her to run for Congress again in the future and be one of those voices for single-payer. Andrea Miller from Virginia, would you step forward and talk about how we end insurance company abuses?
We are currently fighting two wars, and 45,000 Americans have not died in those wars. Yet we do nothing about the deaths of America right here because of lack of health care. We know what the cause is, and we know what the solution is. We need Medicare for all. We know that Medicare works. We've been doing it for 44 years. And we started it with the most vulnerable and the sickest of our population. And it's worked for them. So obviously, if it works for the weakest, it would work for the strongest just as well. That's not a huge leap of logic. So we need Medicare. We need to do it. We need to make the investment in Americans right here in America to keep them healthy. Thank you.
Thank you, Andrea.
If we're going to have a plan that does nothing to protect the 39 million uninsured people in this country, go back and do it right. That's what needs to happen in this country.
Yeah.
So you go back, go to the halls of Congress and you tell them, you need to go back and do it right. When I look at my kids, when I'm talking with my kids who are in their 20s and 30s, they're talking about moving their jobs. I do have kids that are nurses, by the way. You know, they're talking about transferring their jobs, and I said, the thing you got to be concerned about is that you have, whether somebody's pregnant, somebody has an illness, that somebody has something that the insurance isn't going to cover. Insurance companies aren't going to cover it because it's a pre-existing condition. If that's in the bill that comes out of this Congress, McCain is correct. Go back and do it right. This is what needs to happen. Talk to your senators, talk to your congressmen and say, this bill that you're putting before the American people doesn't go far enough. We need single payer, we need Medicare for all. Go back and do it right.
Yay.
Well, this bill is an effort to give the insurance industry their dollars. It's money that Obama got, that the Democrats got from the insurance industry, the pharmaceutical industry, that's being repaid now with our hard-earned money. Our hard-earned money, and throwing $1 trillion at this right now in our fragile economy is a gigantic error. We're already seeing record deficits, and to throw money into a system we know does not work, we know is wasteful, that spends 31% of its costs on CEO salaries and on bureaucracy created by the insurance industry is a waste of resources. Why should working Americans be subsidizing the incomes, the $11 million average incomes of CEOs of private insurance companies? We shouldn't be. This bill is a disaster. It's time to start over. It's time for Medicare for all. Thank you all very much.
Now, what's your thoughts on this movement for single payer? They're calling it Medicare for all, Medicare expanded. What's your thoughts about the movement, and where are we today?
I think Medicare for all is what we should have been pushing all along. It's a shame that Obama didn't come out with that as the starting point and instead came out with the public option, which was already such a terrible compromise. And now look where we are today. If they pass anything on health care, it's going to be such a minor improvement that it's barely worth doing. It really shows how the insurance industry has had the upper hand in this entire struggle, how the Republicans sold us out from the beginning, but the Democrats sold us out as well. And I think that the American people are going to be stuck once again as the only people in an industrialized country that pay more for health care and get the worst health care. And we're going to have to start the struggle all over again from the basic premise of we have something good that works and it's Medicare that's expanded to everybody.
Thanks so much.
Thank you.
Maybe you, but not the damn thing. Howard Furnick was Physicians for National Health Program. They talked this about our single payer as the government takeover, but actually it is the centrist position. And when we say centrist, it means the government is going to finance it, but the delivery will be private pharmaceuticals, private doctors, private nurses in private sector, hospitals in private, labs are in private. It is the centrist position. It is not the government takeover, and that fits in very much with the mainstream America. That's why 65% of the people support us. And the Democrats call the Republicans the party of no, but the healthcare system is the companies of no. No, you can't go to this doctor. No, you can't stay a few days longer in the hospital if your doctor wants. No, you can't have this surgery or that. They are the companies of no, and we're tired of it, and we have to move on. Thank you.
Yeah. Can I try?
Yeah.
Yeah.
Okay.
All right, so actually somebody sent me this song on Facebook the other day, so I changed the words just a little bit. But I wanted, before I sing, just to mention Medicare for all is the centrist solution. It takes public financing that's publicly accountable and mixes it with private delivery. It's the perfect centrist solution. So, not sure how well this is going to sound out of a bullhorn, but here we go. All right? It's nice to block the doorway. It isn't nice to go to jail. There are nicer ways to do it, but the nice way's always fail. It isn't nice. It isn't nice. But hey, thanks for your advice, 'cause if that is freedom's price,